This is an analysis of the town of Bel Air, Florida, presented to you by Emily Fraser Lewis. Bel Air is a thriving community whose history begins in 1890 with railroad mogul Henry B. Plant building a luxurious upscale hotel south of Clearwater called the Bellevue Hotel. It was home to two 18-hole golf courses by World War I. In 1920, it was purchased by John McEntee Bowman, owner of a chain of hotels named the Biltmore, and then became known as the Bellevue Biltmore Hotel, operating until 1940. The town of Bel Air was officially incorporated in 1925. After the stock market crash in 1929, the early 30s brought about desperation, with the town defaulting on over $1 million in bonds. During World War II, the Bellevue Biltmore became Army Air Corps training posts and fields. The 1950s marked a time of new growth all the way through to the 70s, when U.S. Steel purchased land and new condos were being built, increasing the population. Steady growth has occurred since all the way into the 2000s, giving us a combination old charm and new world feel of Bel Air, Florida, housing approximately 4,000 residents. Bel Air is relatively small in comparison to surrounding Largo and Clearwater, with just under 4,000 residents. Largo and Clearwater combined have approximately 200,000 residents, with a median age of between 43 and 48. Almost 30% of Bel Air's population is over the age of 65. With an aging population comes community concerns such as increased health risks for coronary artery disease, heart attack, stroke, hypertension, and falls. The estimated household income is higher than the average, financially reinforcing the community with poverty levels less than 4%. Bel Air is an educated community with low unemployment rates, just under 6%, and low crime rates. One noted difference from Bel Air to its surrounding counterparts is diversity. With 93.5% Caucasian, the lack of diversity can lead to prejudices, judgment, and stereotyping. This community analysis will include structure, population, environment, health-related resources, government, with the goals of the analysis to prioritize community problems and discuss global community issues. The real estate in Bel Air, Florida is mainly single-family homes with the incorporation of a few condos and minimal apartments. While there is some new construction, many homes, although beautifully manicured, appear to be older and built in the 1970s or before. The streets are clean and lined with lampposts and palm trees. There are no electrical wiring that is visible to the naked eye. There are some condominiums, and many appear to be revamped hotels, also dating from the 1970s. Housing varies from single-level to multi-level properties, and all properties were structurally intact and well-maintained. Each property was well maintained with the neat lawns and prim landscape. There's no trash or waste that lines the streets, and there are few businesses within the town limits of Bel Air. Fewer business leads to less structural problems. The Dimmitt Rec Center, the town hall, and the police station are all in the center of town and represent a few of the commercial buildings as well as the public works building. But there are no grocery stores, no schools, no libraries, and no convenience stores. Because Bel Air is so small, it doesn't seem to affect the community because they can all be located in surrounding Largo, Clearwater, and Bel Air Bluffs. Some foreseeable problems with the structure of the community is immediate access to groceries, gas, and pharmaceuticals. But these resources are located within 4 miles. There is really no comparison for health-related resources. Very little is located within the city limits of Bel Air, and all Bel Air residents mainly depend on Largo and Clearwater for their healthcare needs. The only acute care hospital located within the area is Morton Plant Mease Hospital, located in Clearwater, just south of Bel Air. Bel Air has very little skilled nursing and assisted living facilities. Although there are some, many are located in surrounding Largo and Clearwater. The same goes for walk-in clinics. There are none located within the limits of Bel Air. Most are located just outside the city limits. This does not make healthcare accessibility high on the priority list, but it is accessible, being that Bel Air is very small and each is within several miles and driving distance. Healthy People 2020 is an initiative of goals and objectives for health promotion and prevention initiated by the Department of Health and Human Services to come alive in communities and workplaces. The following 3 goals have really come alive in the town of Bel Air, and they are working hard towards achieving these goals and reducing prevalence of these health disparities. Cancer is the #1 leading cause of death. The monitored objectives of this goal include incidence, mortality, and survival used to gauge a decrease in prevalence. Education and reducing preventable risk factors such as physical inactivity and obesity are key. Diabetes, which is the 7th leading cause of death, and reduction of its financial burden while increasing quality of life is goal #2. The percentage of people in Bel Air living with diabetes mellitus is 9%, and it is comparable to the state of Florida at 9.2%. This education on nutrition and encouraging physical activity is key to preventing diabetes. The final goal for older adults is to improve the health and function and in turn increase quality of life. That is the key to this goal. Overall, these goals are being strived towards within the community of Bel Air. The leading causes of death in Bel Air are the same as in Pinellas County: cancer and heart disease. Passing heart disease in 2011, cancer is now the leading cause of death for Floridians. Florida has the 2 highest prevalence for cancer and heart disease in the nation, with causes including poor diet, obesity, and lack of activity. Over the last decade, deaths related to cardiac and heart disease have decreased overall. Cancer is a concern in Bel Air and Florida in general because of the excessive exposure to the sun and its dangerous UV waves. A preventative choice to decrease risk is applying sunscreen and covering up with appropriate clothing. A modifiable risk factor for heart disease is sedentary lifestyle, which Bel Air does a great job at offering health promotion programs and activities for all ages to battle this sedentary lifestyle. It has also been shown that exercise may decrease side effects of cancer and those related to its treatment. The town of Bel Air does not have an active fire department or station within its town boundaries. The county of Pinellas handles all fire, EMS, and first responder needs for Bel Air and its surrounding communities. There are 19 municipal and independent fire departments throughout Pinellas County. The police department of Bel Air is located connected to the town hall. The department consists of Bill Soule, Chief of Police, and Lieutenant Jeff Wolf. There are several officers that are full-time and part-time to support this department. The Pinellas County Emergency Medical Services Authority was created in 1980 as part of a special act of the Florida legislature. The same year when the EMS services consolidated with a fire department to create an integrated countywide 911 operation. The ambulance vehicles are contracted on a performance basis, and the current company operating under the county's name is Sunstar Paramedics. The Town of Bel Air Commission is made up of the mayor, deputy mayor, and 3 town commissioners. Each position within the commission is an elected title, voted upon by the citizens of Bel Air and elected to a 3-year term. Their main responsibilities include writing policies, enacting the legislation, and managing and approving the annual budget. Twice monthly, they hold public meetings in the town hall to discuss current and pending issues at hand. The town commission also appoints the town manager, who is responsible for overseeing and managing all 9 departments of the town of Bel Air. Currently, there are no issues with the budget, and the funding sources are adequate, as well as the allocation of the funds for expenditures. There are no other issues regarding public policy and government within the town of Bel Air. The following are 6 prioritized community issues noted for the town of Bel Air. First is healthcare accessibility. While Morton Plant Mease Hospital is located within minutes, there are only 2 medical doctors located within the town. Second is lack of churches. With an aging population, religion is important to their mental well-being. Without local churches, religious representation is limited, and traveling long distance inhibits attendance, decreasing quality of life. Thirdly, a lack of schools limits options for education and presents problems for commuting and attendance. Lack of diversity can be a problem for existing minorities. There is a lack of representation, and this could affect legislation and decisions that affect their specific population. There is no low-income housing in Bel Air. With a poverty level below 4%, this concern is low on the priority list, with resources available within 2 miles in surrounding Largo, Clearwater, and Bel Air Bluffs. Finally, a lack of shelters and outreach centers means certain populations cannot meet basic needs to sustain their lives. These are all issues that could negatively affect the town of Bel Air if disregarded. Care should be available, appropriate, and affordable. When we think of issues on a global level, it can make the world seem smaller, with a connected population of people dependent upon one another. Nurses share a vision to promote and protect health and can be at the forefront of intervention and education. Access to health care is a global problem, with one end of the spectrum being worries for readmission to a hospital due to lack of primary care, to the other end of the spectrum being infection caused by unsanitary fecal waste disposal in a third world country. The spectrum is broad, and over 1 billion people have no access to health care. While the town of Bel Air has minimal concerns with its access to health resources, other countries don't even have clean drinking water. Some answers to this disparity have included vaccination clinics, public transportation for the disabled, medical humanitarianism organizations, pharmacies that deliver to the bedside in hospitals, volunteer organizations, mobile clinics, preventative care, pharmaceutical donations, and assistance. Community-based collaboratives with the support of policymakers and government leaders and efforts of community-based health care can begin to change global issues at a smaller level. In an attempt for a solution to a global problem, countries like Europe, realizing the aging population and its difficulties, they have implemented several technological solutions with a concentration on prevention and assistance. Patients' cardiac and pulmonary status can now be monitored from home, as well as general assessment findings and vital signs, and then be transcribed and sent electronically to a doctor or a nurse. The roles of the community nurse outside of the hospital will grow, including home health care, home monitoring, home medication administration, preventative care, education, and community resource knowledge. Telehealth is a concept in medicine where technological capabilities combine with medicine to provide accessibility, affordability, and efficient health care, hoping to achieve better outcomes for patients.